Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, India, would like to welcome you all in this lecture of the Ayurvedic pediatrics. You must know this word, Ayurvedic pediatrics, and that is also called as a Bal Rog or Kaumarbhritya Tantra. This is the big name, Kaumarbhritya Tantra. And in that we are today, please open your notebook and write down the date, 25th of October 2023. First, I will slowly dictate the points that we are going to discuss. I am always focusing the topics that are being repeatedly asked in the examination point and also useful for your practice. So, Navajat, Shishu, Parikshan. This is, you can write down in even the Marathi or the Devanagari script, because this is typical Sanskrit words from Ayurveda. Navajat, that means who has been delivered just now. Navajat, coming from the mother. Okay, Navajat, Shishu is that infant. Parikshana is examination. Can you see Parikshana? So in English, in the modern pediatrics, they call it as a neonatal examination. So, but this examination is already mentioned in Ayurveda also. So don't get confused, because it is mentioned in Ayurveda and also mentioned in the modern science. Okay. Just now I will, yes. This is the first big title. And then what subtitles will be there? Now open your notebook and inside of the page, you can write down these particular important words. For example, Dirghayu Balalakshan, who will have live long. So without any astrology, without any palmistry, but looking towards the important features of the body, it has been decided whether this newborn child will live long, say 70 plus, 80 plus, 90 plus, that is Dirghayu. Then Madhyamayu, for example, middle age. The child will live from, say, for example, 40 to 70 years of old. Okay. And Rasva Ayu. Rasva means very less lifespan. Very less lifespan. That is called as a Rasva Ayu Bal Lakshana. So it's a very similar concept of astrology, palmistry, and horoscope, etc. But in Ayurveda, we have also some features that will at least give some idea. But I think these points are also of the point of research. So some MD student should take this topic, who is working in the, taken the admission MD in the Bal Roga Vidyan or Kaumarbhritya Tantra, he can take this topic for the research. But of course, why he will not be able to take the topic? Because he can just see these points. Okay. But after completing his MD within the period of 3 years, that child will be only of 3 years. So how can take the follow-up? That is the most important part, because nobody will live, that especially the MD student is not guaranteed he will live for the 70 or 80 years then to observe this patient. And who is going to give the follow-up? So this research, although it is essential, it's very difficult to follow. One thing can be done. Yes, one thing can be done. Every Ayurvedic hospitals, Ayurvedic colleges and their hospitals, they can keep the record, computerized record. This child has been born in XYZ child born at this, and this Dirghayu Bala Lakshana were found. Keep the numbers, phone numbers, address, fathers and mother, and hospital management can do the follow-up of this data every after 10 years. That is possible. But that will be the responsibility of the Ayurvedic hospitals. Not the MD student cannot do that, or even any Pracharya principal cannot do that. Only the thing can be done that record should be maintained very properly, but at least these points should be mentioned on the case paper. But that is not done in Ayurveda. Very sad, very sad. Whenever you go to your hospital, and please ask and go to that particular department, Kaumarbhritya Tantra, and request them, madam, we have this type of record, Dirghayu Bala Lakshan, Madhyama, whether we are recording those things at least. That is also not done in Ayurvedic hospital, and that is a very sad situation. If any viewer, from any student, from any college, I appeal to all the students, go to your Ayurveda hospitals and inquire whether they are mentioning this or not, at least on the case papers and in the computer. That is okay. Now, this is modern neonatal examination that we are going to see. Factors to be examined. Which factors should be examined? Some vital signs, very important sign. Vital means very important. Like in even ICU, when the patient admits, we are always having, please write down this word. Please write down these words. T, P, R, BP. Capital TPR, these three words. And BP is another. So what is TPR? Always in the modern hospitals, the nurse are given ordered. So write down TPR, BP on the case paper every 4 hourly. For the serious patient, every 1 hourly. What is TPR? Temperature of the patient, pulse rate of the patient, respiratory rate of the patient, and blood pressure of the patient. So that is called as a TPR, BP. These are vital signs because the patient's health status is always up and down. Whether he is living, whether we will live, something very serious. Okay, TPR, BP. Then we will also examine the physical examinations, some measurements that are essential to take, general examination of that particular child, newly born child, color, skin, rash, head and neck, musculoskeletal, muscles and bone, spine, chest, heart, abdomen, genitals, for example, sex, gender, male and female, then rectal examination, posture of the particular child, neurological examination, very important. And I will request you write down these things, neonatal reflexes, please, only these things, please, neonatal reflexes. For this particular point, I have a mobile app. What is the name of the mobile app? Same like YouTube, Ayurveda Academy. That is free to download from Google Play Store. Please convey this message to all your friends. Free download. And there are nearly 12 programs. In one program, there is a clinical examination. And in that clinical examination, fantastic videos are there. Superb. You will never forget when you see those videos repeatedly. And only charges are like 300 or 200, 400 charges of that particular program. So I request everybody, please purchase that clinical examination program and see all these neonatal reflexes, which we are seeing theoretically: Moro reflex, suckling reflex, rooting reflex, stepping reflex, etc. But these reflexes are very, very important for your practicals or examination. Okay. Now we will try to see one after another. But I will request some of the terms, I am not able to explain all the details of that particular condition. That will come across whenever we complete portion. But here only you have to mention that point and we will go further. Okay, because every time I will not able to mention the sign of that particular condition, symptoms, how to examine. Only you have to note down those points. First, Ayurvedic. Navajat Shishu Parikshan. Acharya Charak has mentioned. Now again, as usual, we will try to mark those points. Easy to understand. Charak. First is Charak. Can you see Charak? Charak Sharir. Please write down this reference immediately. Charak Sharir chapter 8. Charak Sharir chapter 8. This is first thing. Next thing you have to write Kashyapa Samhita Sutrasthan. Please write down Kashyapa Samhita Sutrasthan chapter 28, where Navajat Shishu Parikshan has been mentioned. Okay. Mentioned a detailed examination of a newborn child after Namaskarana Sanskar. Sorry. It is Nama, giving the name. I'm sorry. English, because of the English. Namakarana Sanskar. If the described qualities are found in the child after the Namakarana Sanskar, it indicates proper development and long life for the child. I think this Dirghayu practical is also for in Kriya Sharira subject. Please remember or open the Kriya Sharira journal. And in that, for the adult also, you can have these findings. Dirghayu, long life, plus 80. Madhyamayu, 50 to 70. Alpayu, less than 50, heart attack at the age of 30, Alpayu. Okay. Acharya Kashyap has described Bala Ayu Parikshan in Lakshana Adhyay. Which Adhyay? Lakshana Adhyay, Kashyap Samhita, Sutrasthan 28. Generally, the following signs indicate the length of the newborn lifespan. Okay. So this is the Ayu. First, we will discuss about Dirghayu. Who will have a long life? First, you have to check the nails. Nails. It should be long, big nails. That means length and width, both should be long. That is called as a Dirghayu. Again, I will tell you some interesting things. Nails, nakha, upadhatu of asthidhatu. So whenever your nails are best, that indicates that your muscles and the bones are excellent. And naturally, when your muscles and bones are having the good quality, that person has the good quality of life. Sitting, standing, running, everywhere he will be energetic. Then fit, corpulent, well formed, the shape should be well. Upward lines. On the feet, there should be upward lines. Long toes. The toes should be long enough. Now, again, this is some points we can explain very easily. But why is this sign is of Dirghayu? I'm sorry, I'm also not able to tell that each and every point. Like, for example, I have explained about the nails, about muscles, about calcium, about bones, that I have explained. But every time, for example, what is the relation of feet? Okay, but heels, well-rounded and smooth. This is one of the features of long life. I think this is again indicate that your growth hormone is the best. Please write down growth hormone. It may indicate some hormonal, strong hormonal condition when the development is occurring. All the body parts, especially the muscles and the bones, they are developing very nicely. We can understand these things. Ischial tuberosity. Again, the pelvic girdle. Again, it is related with the bones. Ischial tuberosity should be large. Your buttocks, that particular pelvic girdle should be strong enough. Testis should be very good quality. Shape like the bull, donkey, horse, goat, and sheep. Very interesting, but very questionable. Why these symptoms has been mentioned? I think, again, it has a relation with the Shukra Dhatu. Remember, write down that Shukra Dhatu. And naturally, because in the testis, there is a spermatogenesis, formation of the male and female, especially the genitals. We are talking about not testis is in the male. In the female, there are ovary. But simultaneously, we can compare testis and ovary, which are the gonads. GONADS, reproductive organs. If your reproduction capacity is good, because in Ayurveda, Shukra Dhatu is all over the body. Shukra Dhatu is all over the body. It is not semen. Reproduction capacity, cellular regeneration. So naturally, this indicates whenever your genitals and the reproduction capacity is good, the person will be having long life because it can prevent the cell injury, cell damage, cell degeneration. So this is like a anti-aging factors, This is something, a special explanation by Professor Deshpande. It is not given in any of your textbook. Relation with the hormone, relation with the muscles and calcium and all these things. This is not given in any book. Okay. Then back, depressed at the center. That means that your spinal column should be very strong. Your vertebral column should be strong. I take it in that way only. That means whenever your spinal column and brain structures are good, naturally that person will live long and having the good quality of life. Okay, we will go further, but these are all judgments. This, scientific explanation we have to find out still more in detail at some places. Okay, these are the features, only two. Nails are large, that also indicates Madhyam Ayu, and feet bent backwards. Again, this is a question mark. You can make the question mark. You can discuss with your college teachers also. I have no objection. Any of the students get any clue, some more information, please write me back with the comments on the video comments. You can write down, sir, I have found this explanation. Then I will be grateful to him and whole Ayurveda community will be grateful to you. Okay. But at the moment, we are not discussing still more why this, why that. You have to just remember as it is given in the book. That's it. Okay. And then last we will come across the Rasva Ayu Balalakshan. That is a premature death, may occur. May occur. It is not always, it is not 100%. Don't give the shock to the parents. Oh, your child has this particular sign, so your child will die earlier. No, never, 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 never. Even astrologers never tell the lifespan exactly. They say, okay, you will live long. Okay, you take care because there is some indication of accident, etc. But no astrologer is supposed to tell you that you will live 70 years. You will live 80.5 years. That is not expected, I am saying. Okay. Now, nails, white and rounded. Can you have a judgment? White nails. White nails, what does it indicate? Pale. Are you getting my point? Pale. So what does it indicate? Pale, PLE. Blood circulation is not proper. Blood circulation is not proper. So that can indicate anemia. And whenever this child is having blood circulatory problems, his life may be in little bit danger. We don't know. So this can be mentioned. Feet, many lines over the feet, small heel, that means bony parts. Bony development is not good. Small toes and small nails. Again, it indicates the musculoskeletal system problem. Okay. Testis, the same, small and undescended. I think this is very interesting. Please write down this word. Write down here, marker, undescended testis. Very important in your practice. When we doctors go to the schools and colleges for medical checkup program, many camps are there. If you have the nearby school, your college is always the college request to the doctors, please, your team of the doctors will come and examine our children of 9th, 10th standard, or maybe first year BCom, first year BA, first year BSc, FYBS, first year. Now, here, very interesting thing, remember, whenever the doctors go to the school checkup or the college checkup for the students, they are expected to check everything: respiratory system, cardiovascular system, eyes, teeth, everything. But there is also expectation that you should examine the genitals. And in most of the cases, most of the doctors, when they go to the school and college checkup, if there is not privacy for the checking room, specific checking room is not available to examine the genitals, that is bypassed, that is dropped. That examination is not done by the doctor. And that is very, very dangerous. Oh my God, why dangerous, sir? I am saying genital examination is most important part. We can get the idea of testosterone hormone, secondary sex characters, pubic hair, for example, and most important, cursor, undescended testis. Undescended testis is also called as, I will use this word 3 times, cryptorchidism. 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 CRYPTO. Cryptor. CHIDISM. Cryptorchidism means undescended testis. It is expected when the child is delivered, at the time of that particular 1 hour, the abdominal, basically intrauterine life, every male is having the testis in the abdomen. But during the delivery process, that abdominal testis comes to the from abdomen to the testis. Okay. Rather, I can say the scrotum. Testis comes to the scrotum. Testis comes to the scrotum. Scrotal bags are the bags where the testis are there. Male gonad. If that testis don't come to the scrotum, that will remain in the abdomen, and that is not at all good for spermatogenesis, formation of the sperms. Intra-abdominal temperature is bad. That is why intra-abdominal temperature is called as a core body temperature, CORE, core body temperature. And that is why in the spermatogenesis process, there should not be more temperature. So they are taken out of the body in the scrotum. Are you getting my point? And this cryptorchidism problem happens many times. And if it is unnoticed in the childhood phase, when the person gets married, that particular child, young, they get married. After marriage, the couple comes to you that we are not getting the child after 1 year of successful intercourse. Why the problem? And when the doctor examines, he find, oh my God, OMG, testes are not there, one or two, both or one, not there. And then they do the X-ray of the abdomen, sonography of the abdomen, USG, everything. And then they find, oh my God, they have remained in the abdomen and now there is no possibility. All the seminiferous tubules atrophied and no sperms, no child. That is very bad. But if it is noticed earlier at the 9th or the 10th standard, then surgery can be done and testes can be taken from abdomen to the scrotum. This interesting part Dr. Deshpande has mentioned in the lecture of Balarog Kaumarbhritya tantra. So undescended, very important. That power of Shukra will lost, OJ will be not there, and he will have the less immunity. That is my explanation. Umbilicus, irregular protuberance. It may be related with showing the muscle weakness. Hernia is like a hernia, muscular weakness. And whenever there is a muscular weakness, it is related with the skeletal muscle, it may be the cardiac muscle, or it may be the visceral muscle. And that's why that person, that child will get problems in the future, and that can be indicated by this irregular protuberance of the umbilicus. I think this much explanation is enough. Just we have to read these lines. Now we will go for the modern method. Neonatal examination should be performed. How it should be performed? Quiet, warm, and bright environment. There should be enough light to see the structures of the body. The first examination should be completed within 24 hours after the birth. That's why in the delivery room, I have explained already, in the delivery room where the delivery takes place, there should be 2-3 people. There should be gynecologist, there should be obstetrician who is doing the delivery, and there must be pediatrician. When the child is delivered, pediatrician is also there to examine the newborn child. In the delivery room, not only lady doctor is present, but the children specialist also present. Okay, that is very important. Now, why we do this particular examination? Number one, to check whether the baby has made a successful transition from intrauterine life to the breathing. Whenever the child comes out, crying is important, immediate crying. Why? To take the oxygen. And when there is a problem, I have already taken one lecture. You see my previous video, Prana Pratyagamana, cardiopulmonary resuscitation. What should be done if the child is not crying? Crying is most important to take the oxygen and to start your lungs functioning. So one has to check that. To detect any congenital anomalies by birth. By birth, if there are any anomalies, I will explain in the further. We have the examples. What are the congenital anomalies? To detect any adverse effect of gestation, labor, that is the delivery process, or medication. The lady is taking some medication. Whether that they have some effect on the child, we have to see. To detect any sign of infection to the newborn child or metabolic diseases. So we have to find out all these things, and that's why we are doing the newborn child examination. Okay. Now, what is to be examined? What to do? So you please write down. I will wait for you. Please write down these 4 points. Number one, at least you should write down the key words. Every viewer must try to write down in the notebook specially prepared for Professor Deshpande's lectures. Write down the important key words. That is called a very important word. If you remember those words, you can give the explanation in the examination. So what factors? Number one, vital signs. Vital means very, very important signs. I think I have given you the difference. Symptoms means the patient is complaining, and signs the doctor is examining. I have already given you example. When the patient is complaining, doctor, I am having the pain in abdomen. Oh, that is a symptom. Pain in abdomen, udara shula. But when doctor press on the liver area, doctor is examining the liver and he is pressing on the liver. No, after pressing the liver, the patient is grumbling, crying, shouting. That is called as a tenderness. So liver tenderness is a sign. Pain in abdomen is a symptom. So these are the vital signs. Then physical examination, structural, neurological, most important with the brain, spinal cords, cranial nerves, etc. By the by, that's why I am telling you, in my mobile app Ayurveda Academy, there is superb nervous system examination. Superb. My guru, my teacher is Dr. A.R. Joshi, sir. He personally MD modern physiology doctor. MD modern, not Ayurvedic, modern physiology doctor. He has shown how to perform the intelligence, higher function test, how to do the cranial nerve examination, how to do the motor system examination, how to do the sensory system examination, how to take the reflexes, everything superb. So please download that app and purchase that particular program. Estimation of gestational age, whether it is a perfect 9 months and 9 days, or it is a preterm, or it is a post-term. We have to see everything. Now, we will talk about here. Can you see? These are the vital signs. Again, only A, B, C, D you write down. Please, which are the vital signs? I have already explained you. Temperature, TPR, then pulse, heart rate and pulse rate are the same. What is the normal temperature? You know this. In the thermometer, there is a red marking. If it is a Fahrenheit, 98.5, usually it is mentioned as a normal. If the mercury goes above that, 99, 100 degrees Fahrenheit, 101, that is a fever, pyrexia, jwara vyadhi. Okay, so we have to check the temperature, especially axillary temperature should be measured here. You have to clean the armpit, then put that and hold it like this for minimum 2 minutes, and then rolling that thermometer you have to check. But before keeping the thermometer, in the adult at least, you have to shake it and take that mercury below to that red line, below to, and then only put it in the armpit. I am telling you how to examine in the adult. Okay, for the pediatric these things, you have to make a lot of practice. You have to attend pediatrics clinics in your hospital, or even the private pediatrician. Go to the private pediatrician, make observership, and learn, because pediatrics is such a delicate science. Unless and until you go to the pediatrician and learn these things by yourself, only theory is not enough. No. Similar for any specialization. You know that this Bala Roga is a specialty of Ayurveda. Because many doctors, they ask, are you doing BMS? Oh, do you have any specialization, super specialization? Do you have any post graduation? Do you have any MD, MS? Then tell them firmly, yes. In Ashtanga Ayurveda, we have already mentioned specialization by Vagbhat and Charaka 4000 years BC. Kaya, Bal, Grah, Urdhvanga, Shalya, Danshtra, Jara, Vrishan. These are the 8 special branches. So Kaya Chikitsa, Bala Chikitsa. Second, Bala Chikitsa. That is Kaumarbhritya tantra. So we can become even mastery in pediatrician. You can make only consultation after you are passing MD in Kaumarbhritya tantra. You can practice only pediatrics. That is not a problem, because you will learn both Ayurvedic as well as the modern. Heart rate, it should be examined by the auscultation, stethoscope, and is counted every minute. Minimum 1 or 2 minutes it should be counted. And in the children, now this is very, very IMP. Please write down. Please write down. Adult pulse rate, adult, ADULT, or adult heart rate, yours and mine. How much should be the heart rate? Please write down. Yes, 70 to 80 per minute. 70 to 80, any number per minute. Can you see here, children, newborn? Can you see? 120 to 160. Very important point. Please write down 120 to 160, nearly double of the adult. तो ऐसा कैसा हो गया? बच्चों में ज्यादा क्यों है? बच्चे तो इतने से थे, इतने से है, इतना सा हार्ट है, सर इतना जोर से क्यों धड़क रहा है? Why the heartbeats are more in such a small newborn baby? Why? The question will be asked in the examination. The question will be asked in the examination. Why the heart rate is so double than the adult? You write down the answer. Please write down the answer. Heart rate is controlled by, please write down, heart rate is controlled by vagal, V-A-G-A-L, vagal tone, T-O-N-E. Heart rate is controlled by vagal, V-A-G-A-L, tone, T-O-N-E. So what is that? This is vagus nerve. Please write down. Vagus nerve is very important, and vagus nerve keeps the control on the heart rate. Then what is happening? In the children, nervous system is not developed fully. In the newborn child, nervous system is not developed fully. So there is not proper vagal control. There is not proper vagal tone on the heart. So heart rate is more. There is no control of, in the adult, in your heart and in my heart, there is a vagal control which is called as a vagal tone. And that's why our heart rate is within 70 to 80. But in the newborn, no vagal control, so heart rate is more. Clear? Clear? Okay. Respiratory rate, it should be examined by observation and counted for full minute. Simple thing, you can put this palm on the abdomen and just keep the watch like this, and how many times your hands on the abdomen is going up and down. That is counting of the respiratory rate. It should be, again, it is more, 40 to 60 per minute, because lot of oxygen he has to take. Lot of oxygen he has to take, 40 to 60. Our adult respiratory rate, that is called as RR. Adult, how much? Only 14 per minute. Okay. Then BP. BP is not measured in the newborn routinely. Normal BP varies with gestational and postnatal ages. Okay, that we will discuss afterwards. Okay, my dear friends, let us move further. Now we will talk about physical examination. Step by step, no hurry and worry. First examination is done in the delivery room as soon as possible after delivery. Second examination is more detailed and is done after 24 hours of life. Third examination is done within 24 hours after discharge from the hospital. So 3 times. First, within 24 hours, within 1 day, immediate. Rather, first is as soon as possible. I'm sorry. Immediate after delivery. Next, detail within 1 day. And then 24 hours after discharge from the hospital. Okay. Measurements. First, you have to measure the birth weight. It should be normally 2.6 to 3.8 kilogram, the normal birth weight of any normal delivered child. What is low birth weight? Then you have to take special precaution. Less than 2.5 kg is called as a low birth weight baby. This is also asked in the examination. Oral, all these numbers are very important for the oral practicals. They will be asked. Babies lose 5 to 10% of the birth weight in the first few days and regain after birth weight by 7 to 10 days. So immediately after birth, there will be weight loss, but it will be increased again after few days. Length from head to toe, 48 to 52 centimeter from crown to heel. From crown, this part, to the heel. That is, measuring tape is done and it is measured directly. Okay, we will go further. Now, here you can see head circumference. You have to measure head circumference. Here you have to put the tape and measure like this. It should be normally 33 to 38 centimeter. Frontal bone, this frontal bone, and most prominent part of the occipital bone here are taken as a referral points for measuring the tape. That means here and these 2 points. This is occipital. This is frontal. This is parietal. This is occipital, and this is temporal lobe. Temporal lobe. Okay. Now we will go further. General examination. What are the points in general examination? Step by step. I will mark it and we will see. First, you have to see the color of the baby, skin color, whether it is a pallor. Pallor in the eyes, in the skin, it indicates the hemoglobin is low. And the patient may be in the shock. That is a less blood supply to the brain. That is called as a shock. Then cyanosis, bluish discoloration, cyanosis, bluish here, bluish discoloration, BLUI. Bluish means it's not, oxygen is not good. So oxygen level is less, so hypoxemia. Plethora, that is polycythemia. Okay, that means RBC count is more than the normal. That is polycythemia, or hemoglobin is more. Jaundice, how you can detect? Hyperbilirubinemia. Here you can see amia is a blood. You have to check immediate blood. And when there is a bilirubin level is too high, that is called as a hyperbilirubinemia. That indicates the jaundice, liver problem. Skin, you have to check the purpura, any bleeding spots. This is all bleeding spots, some capillary bleeding, purpura or ecchymosis. Then if there is any mottling, vernix caseosa, I will explain all these terms after some time. We will make a dictionary for these terms. Okay. By that time, you can search for on the Google also. What is vernix caseosa? What is mottling? And you can also prepare yourself this particular list. Edema. Edema is a swelling. Pedal edema or the whole body edema or the facial edema. Then Mongolian spots. You have to check those. Rash. Any rashes? Milia, erythema toxicum, and diaper rash. Diaper, you know, diaper. At the anal region, anorectal region, there is a red colored patches. That is called as a diaper or the napkin rash. Then head and neck. You have to check that you have measured. So whether it is a macrocephaly, big head, macro means big, head is big, macrocephaly, or microcephaly is less in this thing. Then caput succedanum. Then you have to check caput succedanum. Cephalic here, hematoma, blood clot. Hematoma is a blood clot. Fontanelle, you have to check bulging of the fontanelle. That indicates the pressure inside is more. There may be some hydrocephalus or something like that. I will discuss technical things afterwards. Simple, you remember. Other things will come automatically, slowly and steadily. But at least you remember this point. Eyes, you have to check the pupils, you know, the central part, pupil, where the light rays are entering. A small hole, that is pupil. It is dilated, it is small, like that. Then squint, tiralepana in Marathi, that is deviated on one side, squint. Then cornea, you know the cornea part, that central colored part. Conjunctiva, bulbar conjunctiva, white part. And the covering on that, white part is a sclera, but covering is called as a conjunctiva. Like iris, color part. Ear, you have to observe the shape of the ear, this in the newborn child. Nose, patency of each nostril, that means this central septum. Many times afterwards, at the age of 8 and 10, it is observed that he has a repeated cold. That is because of the DNS. This, like this. Deviated nasal septum, DNS. DNS, deviated nasal septum. Okay. Then flaring of the nostril, like this. Flaring. Very high fever and the child is very breathlessness. Then this alanasa are moving. If they are moving too much, that indicates the fast heart respiratory rate. Then mouth, tongue depressor and upress. Cleft lip here. Lip. This lip cleft is a tear. फाटलेला. मराठी मध्ये आम्ही फटा हुआ ओष्ठ बोलते ना, तो क्लेफ्ट लिप का मतलब है फटा हुआ है वो. और पैरेट, cut, there will be cut. It is not unified. That is called as a cut cleft lip or cleft palate. It may be palate or it may be lip. Afterward, it is immediate surgery is done and it is united together. Tongue tie here. the frenulum is stick and it's very not flexible. So that is called as a tongue tie. If surgery is not done, afterwards there will be problem in the speaking. Okay. Then natal teeth, if there is any teeth, there should not be. Then neck, all the neck region is observed, and cyst and masses, if any tumor, etc., we have to observe that. Okay, we will go further. Then here you can see a little bit more musculoskeletal system, spine, and all these things you have to check. Many musculoskeletals, fractures. That the pediatrician is expert and he can examine by just pressing the child is crying and not deformities of any bone, dislocation, whether all the joints are there, shoulder joint is proper, elbow joint is there, wrist joint is there, all he check, everything, also leg, everything. That is dislocation, moving from one place to another. Polydactyly, these fingers, the number is more. For example, I know that our great actor Hrithik Roshan have a little bit polydactyly. You just confirm, but I heard about it. Polydactyly, excess finger. Then syndactyly, if they are united together, syndactyly. Then spine, whether there is a meningocele, any tumor or this thing. Chest, deformities, respiratory pattern, auscultation, wheezing sound is there. It indicates a bronchial asthma. Wheezing is always bronchial asthma, don't forget. Wheezing sound when you auscult the chest, that indicates bronchial asthma. Stridor and grunting, lot of mucus is there, secretions are there, then the stridor or grunting sound can become. Okay, we will go further. Okay, this one. Now we have to observe the chest. In the chest, the deformities, then respiratory system. I think this we have understood. Then heart, tachycardia. What is tachycardia? Excessive pulse rate. Normally it is high, but still more. Very, very tak, 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 tak. That is called as a tachycardia. Increased pericardial activity on the chest region. He has to observe that pediatrician, children's specialist, he is doing all this neonatal examination. Auscultation, whether there is in the heart, abnormal heart sound. Please write down. Abnormal heart sound is called as murmur. M-U-R. Interesting word. In the children as also in the adult. Murmur. M-U-R. Abnormal heart sounds. What is normal heart sounds? Lub, dup, lub, dup. L-U-B-B-D-U-P. Lub, dup, lub, dup. Normal heart sound. But just listen carefully. Lub, sh, dup. Sh, lub, dup. Whatever sh, that is called as a murmur. That sound is called as a murmur or any irregular rhythm. Normally it should be lub, dup, lub, dup, lub, dup. That is regular rhythm. But when there is arrhythmia, that is called as a pathology, arrhythmia. That is irregular rhythm. In your stethoscope, in your pulse finding, that will come as arrhythmia, irregular beats. That is very important. Then abdomen, organomegaly. What is that organo? It may be liver or it may be spleen. So hepatomegaly, megaly means increase the size. Liver will be enlarged or spleen will be enlarged. Splenomegaly, hepatomegaly. Hepatomegaly common in jaundice. Splenomegaly common in the blood problem. Severe anemia, blood destruction. It is related with the splenomegaly. Then any distension of the abdomen, any fluid, peritoneal fluid, like for example, ascites. It is not, but maybe we have to check it, ascites. Some abnormalities may happen at some children, very few children. Now we have to check the genitals. Can you see here? In the male, scrotum is well developed with deep rugi, okay, and descended testes. I have discussed a lot. What is undescended? Have you written down? Cryptorchidism, problem with the spermatogenesis. That is okay. Now here preterm. What will be the preterm? Below that particular 9 months, 9 days, small scrotum, few rugi. Rugi means in Marathi, vaya, wrinkles, creases that over. Absence or undescended testes, both possible. In the females, labia majora completely covers labia minora. This is normal. But in the preterm baby, labia majora is widely separated and labia minora is protruded and there may be vaginal discharge. This is for preterm. This is all about neonatal examination. We will go further. Now, rectal and posture. Malformation may be there. There may not be opening of the anal, dislocation, prolapsed rectum. Hips are abducted away from the central line, partially flexed knees. Arms are abducted and flexed at the elbow. Then fists are often clenched. This is normal. Huh? This is all normal. Fists. This is fists are clenched with fingers covering the thumb like this. Like this. Okay. Now neurological examination. What we have to see? The muscle tone. Okay. This is already explained in my app in nervous system examination. Support the infant with one hand under the chest. The neck extensors should be able to hold the head in line for 3 seconds. Only 3 seconds. Now, there should not be more than 10% head lag when moving from supine to sitting position. Everything is done with the support. Always look. That's why my videos are very important in the app. Neonatal reflexes. Reflex is an involuntary act to the stimulus, not notice, without notice. In the adult also, you should remember able to do all these examinations. These are autonomic actions that do not require higher level brain functioning. They are also known as the developmental or primary reflexes. They can provide information about the integrity of the CNS, that is brain and spinal cord and the nerves. Their absence indicates the CNS depression, problem with the brain. Now, let us see. This is a Moro reflex. I'm sorry. First one. Onset, when we get this reflex, 28 to 32 weeks of gestation, disappear within 6 months. Stimulus, when the baby is in supine position, elevate the head by a hand. You will not understand if I explain this way. You just go download the app, see these reflexes in the pediatrics. Then allow the head to drop suddenly. Response, extension of neck, extension and abduction of upper limb, flexion and abduction of upper limb and crying. Very delicate. We should not do, normal person, normal doctor should not do all these things. This requires the training, proper training under the supervision of pediatrician. Then only you can do with the newborn child, other it will be fracture to the neck. Okay. Bilateral absence indicates CNS depression by narcotics or anesthesia that is done during the delivery process. Brain anoxia or very premature baby. If this reflex, abnormal reflex is there. Asymmetry response that indicates the Erb's palsy, clavicle or humeral fractures. Persistent beyond 6 months. If it continues, that indicates there is a CNS nervous system damage. Okay. We will go further. Next responses from the newborn child. Suckling reflex. This is simple. This is very simple. Onset 32 weeks of gestation, disappears after 4 months. Stimulus, finger or nipple, both, is placed to the mouth and responsive. Very easy. This is very easy. That doesn't require any training. But your hands should be very, very clean, sterile, clean, without any smell. And then you just put your one finger or little finger basically, and that newborn child will start suckling to your finger. That is called as a suckling reflex. That it indicates it has a natural, knowledge how to suck the breast milk. So that is called as, even nipple, immediately it starts. It is by birth, the God has given this particular reflex to the newborn child. This is very easy. That doesn't require training to the doctor. Okay. Then rooting reflex, onset 32 to 34 weeks of gestation, disappear within 4 months. Stimulus, striking the upper lip or corner of the mouth. Response, head turns towards the stimulus and mouth opens. For example, this is also very simple, very simple. It is given in my mobile app, Ayurveda Academy, Google Play Store. Download, purchase the program, clinical examination. Okay, just you keep it over here. You are just stimulus, striking of the upper lip, corner of the mouth. Then what happens? The child will look over there, and the child will feel that there is something to eat, and he will rooting reflex. That is called as a rooting reflex. These two are very, very easy and simple training you can do with the newborn child. No problem. Next, we will go further. Now we will talk about stepping reflux and placing reflux. But before that, let me once again tell you, at least you should remember all the names of the reflexes. That will be definitely asked in your Kaumarbhritya Tantra practical examination, 100%. Even this is asked in the written also. Write down this reflex, write down that reflex for ACQ. And describe neonatal examination fully, 15 marks. So this is a common question. Onset, 35 to 36 weeks of gestation. This appears within only 1.5 months, 6 weeks. Stimulus, touching the tip of the feet to an even surface while the infant is held upright. Okay, infant makes movements that resemble stepping. If you touch to the feet, it will do its movement of the feet like this, stepping. That is called as a stepping reflex, as if he is climbing the upstairs. This is very easy to take. Placing reflex. A newborn flexes the knees and brings the foot up when the sole of his or her foot is rubbed. When you rub the sole by hand, immediately the newborn flexes the knees. He feels, there may be some danger. Flexing of the knees and brings the foot up. This is also very easy. I think these 4 reflexes are very easy to conduct and very easy to see. Okay, that first one was a little bit difficult. Now, palmar grass reflex. I think this may be the last one. Onset, 36 weeks of gestation. This appears within 4 months. Stimulus, placing a finger on the palm. Response, this is the easiest reflex. Only you have to put over here and it will close the fist. So significance, if it is absence, that indicates the CNS depression. If it is persistence, then CNS damage will be definitely there. So you have to palmar grass reflex is also available for your testing. So my dear friends, let me tell you once again what we have learned in this 1 hour, not exactly 1 hour, but maybe in these last 50 minutes. So just open your notebook and see whether you have written Navajat Shishu Parikshan or Neonatal Examination. This was today's topic. There we have discussed about Charaka Sharistan, chapter 8, Kashyap Sushitrustan, chapter number 28. We saw the Dirghayu Balarakshan, Madhyamayu Balarakshan, and Rasvayu Balarakshan. I mentioned it may be related with the musculoskeletal system, it may be related with the nervous system, or it may be related with the Shukra Dhatu or the Oj, etc. I think this explanation I have given. Then in neonatal examination, what are the objectives? We have to check whether there is any congenital anomalies, any malfunctioning, infections, and all the parts are okay or not. Factors, vital signs, physical examination, neurological examination, and examination of gestational age. In vital signs, we have seen the temperature, heart rate, respiratory rate, and blood pressure. Then physical examination, we have talked about weight, length, and head circumference. Only you have to remember the points. General examination, you have to remember this side: color, skin, rash, head and neck, musculoskeletal, spine, chest, heart, abdomen. And then genital, male and female different, rectal and posture. And neurological examination, we see the muscle tone and also neonatal reflexes. Which are the neonatal reflexes? Moro reflex, suckling reflex, rooting reflex, stepping reflex, placing reflex, and palmar grass reflex. My dear friends, thank you very much for your quite good patience and responding me very well. Tomorrow, on the Thursday, we are discussing the missed lecture on Dasra, because Dasra we have not taken the lecture. So tomorrow from 7 to 8 p.m. we will talk about Stri Roga Prasuti Tantra Vijnan, some important topics which are related with examination and also with relation to the practice. Okay. Thank you very much. Take care and good night. See you tomorrow.